Also in health news, it's a condition that, listen to this, affects up to half of all Americans between age 18 and 65.
But you don't have to live with receding gums. Dentist Dr. Blanton is here to explain just that. Well, for starters, I'm very intrigued with all of this because I'm very new to this. So tell me what it is and how do you get it?
Well,
or how does it happen? Yeah.
There's several different ways. Periodontal disease can cause gum recession. Also, hard brushing, improper brushing techniques can cause gum recession. Sometimes just misalignment of teeth can cause gums to recede.
And basically it means the gums receding and you could lose teeth if you don't do something about it, right?
Right, eventually that's a possibility.
Okay,
sure.
So it's important to treat, but up to now, what's been the treatment?
The primary treatment's been what's called gum grafting procedure, where basically the periodontist or dentist takes a graft of tissue from the palate of the patient and then grafts that in the area where the recession is occurring.
And the disadvantages of that are?
Well, as you see in the video, you have a wound in the palate that has to heal. There's incisions that are made above the receded areas. The tissue's laid in over those and then sutured into place.
Sounds painful.
I was about to just say it looks painful, and I can only imagine having it done.
Patients will tell you that the most painful part of that is the palate incision.
So what's the new one you just started doing a couple of months ago in your office?
It's this pinhole procedure where we make a small incision, a small pinhole incision with a needle, and then go in with special instruments to reflect the tissue away from the bone, loosen all that tissue up, and then position that tissue in the new position where the gums have receded. And then we take small collagen strips, sterile collagen strips, and go back through that pinhole and actually wedge those in between the teeth to kind of hold the gum tissue in that new position.
Nice. So you're not using your own flesh to graft. You're essentially, does it also cause the gum to grow more gum tissue, the collagen strips, or no?
No, not necessarily. What it does is that tissue will then reattach to the bone in that new position after several weeks. You know, you have to be careful with those areas just like you do in a normal grafting procedure. Until that tissue reattaches. But probably one of the drawbacks to the grafting procedure, aside from the discomfort and all that, is that a lot of times the tissue doesn't look real natural in those areas.
And this one it does.
It looks very natural.
So if you do the new procedure, do you have to get it done again in 10, 20 years, or is it something just one and done and you can have it for us?
It would be nice if everything was permanent.
Okay.
But sometimes it's not. But if you do take care of those areas and are careful with the brushing, you know, they should last.
And is it covered, because it is a new procedure, is it covered by insurance?
It should be covered by most dental insurance coverage.
Excellent.
It's a grafting procedure.
Excellent. Well, we're going to put on the screen where people can find you, because believe me.
The pain factor, the first one looked like severe. The second one looks less painful.
Yeah, it's a big deal.
Big time.
Thank you so much.
My pleasure.
Appreciate you.